This is Dr. Aishwarya Matikati. I'm a consultant infertility specialist in Tamra Hospital and IVF Center, Rajajinagar. Today's topic of discussion is, which I'm seeing every day, the couples coming to us, is when is the right time to conceive. This is what is the thing which is running around many of the couples. So nowadays, as per the present scenario, what we are seeing, I feel that the way we are living our lifestyle and the stress which is happening in and around, and the environment condition and the food habits what we are having, I think so this planning has to be started not less than 25 or 26 years if the women is 10 and the men around 31 or 32, because what we see the last 10 years and what we see now in this 10 years, there's a lot of changes which has happened. The next question usually the couples ask is what, when and how. When we need to approach and what are the things to do and how we have to go through it. So first thing is, usually we tell that in case if the couples are planning to conceive, so 6 months to maximum 8 months of natural trial, that is without using any kind of contraceptives. If they have tried and they are not able to conceive, then they have to come and see a specialist, that is any infertility specialist or any gynecologist. So it is better to go. So once you go, so the next thing is what all the things you have to undergo. So normally if at all the couples comes to us and they say that we are planning to conceive and we are not able to conceive, we have been trying from for 6 months. So first thing we see is the basic blood test for the both a husband and a wife. So for the husband we see the semen analysis, and for the wife we see with the hormonal analysis. We see the day 2 regarding her ovarian genesis, and we see her uterine functioning, and we see her egg reserve, and we see whether she is ovulating. So this is the initial protocol what we do is. So once the initial protocol is done and once everything is normal, then we send back the couples telling that you again try for another 3-4 months, but let it be a monitored cycle, that is we call the wife 10th day of her period, to see the follicle monitoring, to see whether she is ovulating or not. So followed with the 2 or 3 scans, once the egg is released, we tell them to be in natural intercourse and try for 15 days and come back after 15 days for a pregnancy test, or they can do a urine pregnancy test. Suppose the couples are not ready to come, like it is very difficult for us to come and see every alternative day. So nowadays we are telling them to try to use a ovulation kit, that is starts from the 10th day, which is available everywhere in the pharmacy. You can start with the ovulation kit. So watch out, it's just like a normal pregnancy. So suppose 2 lines are coming, that means you are ovulating, and when the 2 lines are ready, then you can plan to have a intercourse, and then followed with that after 15 days just do a pregnancy test, so that you can, if it is positive, you can come and see the gynecologist. Like this, if at all they follow this for 3 or 4 months and still they are not able to conceive with this kind of a protocol, then they have to intervene themselves for the scanning or with the ovulation induction, so that we make the eggs to generate, and then followed with the follicle monitoring. And even with that the patient is not able to conceive, then we go to the next stage, that is after 1.5 years of trying, or 7 or 8 months of trying. It depends on which stage she falls across. Then we will go for her histoscopy or we will do, that is we'll see the tube testing to see whether the tubes are patent or not. So that can be done in all 3 ways, that is ultrasound guided, then we can do through the HSG, that is pushing a dye and taking an X-ray, and then is through the laparoscopy to see whether the tubes and whether ovaries and the uterus, everything is normal. So these are the certain ways where the couples are intervened in based on which stage they belong and when they are planning. So it is better to all the couples who are planning to try, who are going for the trying also. So I usually recommend the couples to just see for 6 months, and if they are not able to conceive, please see a gynecologist or the infertility specialist for the further management and the treatment.